I'm the HRD administrator. I'm here with Director Fawcett with A&I and the rest of the commission, and I will turn it over to Senator Emmerich, who is going to probably lead the commission today, and I'll turn it over to you for the agenda.
Thank you, Patricia. This places me in somewhat of a awkward position, being chairman of something I don't know what I'm doing. But that's also not anything new. So, I have the commission members read the minutes, and I accept the motion to approve the minutes of the previous meeting.
I was so moved by Brenda. Minutes.
Second, this is Rita.
What was that?
Second.
Oh, Rita, okay. I forgot you're on the phone, Rita, thank you. Been moved and seconded for the approval of the minutes of April 19. All in favor, say aye, please.
Aye.
Aye.
Thank you. Motion's passed. And I would now open the floor for nominations for chairman for the ensuing year.
I would nominate Senator Emmerich.
Nominated, I will not run. If I run, I will not serve. Yeah.
We'll see about that.
Yes.
Surely I'll second that nomination.
Moved and seconded that Senator Emmerich take the chair for the next year. Those in favor say aye.
Aye.
Opposed? No, it is passed. Patricia, would you bring us up to date on the next item, housing allowance, please?
Last April, I certainly will, Senator Chairman Emmerich, the housing allowance policy eligibility requirements, we had a discussion at the April Compensation Commission meeting, and we talked about a couple options. Right now, Teton County is the only county that has the housing allowance eligibility. We talked at length on how to ensure that we're being good stewards of the money, and we haven't really made a decision on that. So we are at a position now where I don't think, from what we've looked at, we don't see that there's a lot of overspending for that. We were concerned that there's so many P.O. boxes, a lot of people living in one house, maybe getting a little more than a single person who is living in a condo that is paying, $2,500 a month, they're getting a $1,200 allowance. But if they have 6 bedrooms and 6 state employees living in the same condo. So we haven't decided to ask for rental agreements, and I don't believe the commission has made that decision. I'm not sure that it is an overarching problem that we would want to start really looking at and making them turn in their rental agreement. So it's up to the commission how they want to do it. Right now, anybody who's a state employee in Teton County or grandfathered in Victor or Afton, they do get the housing allowance. Whether they live with 3 people, whether it's their second house and a second mortgage, we do know there may be a few of those. I don't know if that changes your opinion or not, but I don't think it's an overarching problem.
What is the amount of the housing allowance?
Right now, it's $1,214. $1,214. And that'll change again, may or may not change again in late May when we get those numbers. So every year we relook at those numbers.
Comments? Thoughts, Commission?
Mr. Chairman, I think that the advice we got from staff just now is probably appropriate. That anytime you have a housing allowance, it's got to be, the way anyone calculates it is based on averages. Sometimes, there's going to be people that, can make it a justification that they should have more, and some could be less. But you got to trust the averages, and you got to trust the methodology.
Thank you, Representative Madden. For myself, your comments that there does not appear to be a problem. I, for one, am a little reluctant to turn this commission into a group of detectives. I think we've got much better things to do, and until I hear differently, I would say that you're handling the problem as a problem, unless someone has a different comment. I think it should just let sleeping dogs lie. I don't even know if we've got a dog here.
Mr. Chairman, I'm in agreement with that.
Thank you. Well, with that, we will move on to the next item.
The next item is the Employees Group Insurance Update. Unruh, the EGI HR Program Supervisor, is going to give a presentation on where we are with employees group insurance.
Good morning.
Good morning.
Mr. Chairman Emmerich and members of the commission, I am Pam Unruh with Employees Group Insurance. And I'm kind of going to give you some highlights, some updates about what's been going on with our program this year, as well as some impacts and some things that will be happening next year. The Affordable Care Act, the healthcare reform that you hear every day in the news that they're going to appeal, they're going to abolish, they're going to amend the Affordable Care Act. Well, as of today, it's still the law of the land, and everything is still in place, nothing's changed, and we have to administer the program with all the rules that are federally regulated as of today. So we don't see that changing in the near future. So some of the impacts that have been made by the Affordable Care Act for our program are federal regulations that require that documentation needs to be distributed to employees so they can make informed decisions about their benefit elections, as well as information that goes to the IRS from the employers indicating who has health insurance coverage through their employer. That is also reported back to the employees, which indicates who had coverage and what dependents were covered under their plan also. So they aren't having to experience a penalty for not having insurance. A lot of individuals don't realize the population that is covered by the state insurance program. You can see up here that the executive branch, state employees, really make up less than half of the population of our program. You can see up there that UW makes about 17%. K through 12, now we only have one school district that has opted into our program, the Troma County School District number 1, and they make up about 12% of our program. And then the retirees make up about 13%. The community colleges are making up about 10% of our program. But state employees, less than half. This year, we had increased the deductibles on the two lowest deductibles that we have on our program. So the $350 deductible that was in place was increased to $500 deductible, and the $750 deductible was increased to $900. So we had some movement towards that lowest deductible during open enrollment last year for this year. So you can see up there that about 60% of our population are in the lowest deductible that we offer. The next deductible being that $900. The $1,500, $3,000 qualified high deductible health plan, that is a plan that allows individuals to participate in a health savings account, healthcare savings account. So it does have a slightly different plan design than the other deductible plans. Now the $2,000 deductible plan is our highest deductible that we offer. However, it's not a qualified high deductible health plan because it has the same plan designs as the other deductible options. So those are the deductible options that we offer as part of our program. We always remind individuals that the amount that the state contributes towards their benefits really is part of their total compensation package. The amount that is contributed to a person that is electing single coverage gets over $750 towards their benefits. If they have family coverage, they are receiving over $1,700 currently towards their benefits. Pretty hefty chunk of change for an individual that is beyond their annual salary. So I think this means a lot to the employees. This amount that is contributed towards their benefits also is on a pre-tax basis, so it's ultimately saving all of us money too. Two new benefits that were available through our program this year is a hearing aid discount program that is made available through enrollment through either our VSP Vision program or through the Cigna health insurance program. Now, the True Hearing through VSP, if you are enrolled in the VSP program, you are able to take advantage of a discount program through your enrollment. One cool thing about the enrollment for the True Hearing one is that you were able to utilize this for your extended family. We have a person in our office that actually used it for her father, and he saved about $1,000. So it could be very beneficial for our members as well as the retirees utilizing this benefit too. So if members are not enrolled in the VSP program but are part of the Cigna health insurance program, Cigna also offers a hearing aid discount program through their enrollments also. And I'm afraid it isn't for extended family on the Cigna program, but they still have that availability there. So a good benefit. This is always a fun slide. So in 1999, you can see that we paid about $38 million in health care expenses on our plan. As you go up the years, you can see we go up and up and up and up and up, but all the way to 2017, where we are projected to pay out almost $300 million worth of health care claims. Now, this is a perfect example of healthcare inflation. It's not only our plan that is experiencing it, it's health plans across the nation. Wyoming is a hard state due to the rural nature of our state. It does create some additional expenses there. This is basically a bar graph of the previous slide, but you can see up on the upper left hand, the red line. We have not had a rate increase for 3 consecutive years. Now you can see that that line is where the premiums have been, and you can see that the columns for the claims, they keep going up. So what that means, if you keep the premiums down and the claims go up, it usually means you're going to have to increase the rates for the next year. So guess what? Yep, we're having to increase the rates for next year. Now, if you look up there, you can see that a person that has elected single coverage will be paying approximately $15.77 more for their coverage for next year. If they're electing family coverage, about $34.34. Now, we had minimal benefit changes for next year, but wanted to talk about what those were. For non-participating providers that are not contracted with Cigna, the reimbursement level is moving to a 200% of Medicare allowance. Now, what this means is trying to come to an industry standard, what is reimbursable to non-participating providers across the country. So all the providers know what 100% of Medicare allowable is. Currently, it can be greatly skewed in a region determining what usual and customary is for a non-participating provider. Because one provider can charge $3,000 for a procedure, and another provider in the same area can charge $300. What is the usual and customary for that procedure? So when we're moving to this Medicare allowable, this is a well industry standard, and providers will know exactly what they will reimburse for any given procedure. This does not affect any participating Cigna contracted providers, only those that are not participating providers. The other change that we will be making, the federal limits have increased for the medical reimbursement piece for the flexible benefit program. It will be increased for 2018 to $2,600, allowing employees to elect pre-tax money to be put into account for reimbursement of medical expenses. Another thing that was offered this year was the availability of a telehealth benefit. This allows members of the Cigna program to get medical services via a smartphone, a laptop, a desktop, They are able to log in, to do a short medical history, and able to get medical services via a computer. And this is very advantageous for those individuals that live in very rural areas that don't have immediate or access to medical care, and it's 24/7. It currently costs $40 a visit and is linked into the Cigna information site, so they know exactly how much the patient will have to pay. They can tell if their deductible is met, and it's proving to be a very beneficial benefit. So one of the things that we are trying to push this year too is the availability of some tools that individuals can see what will a certain procedure will cost them. So we are encouraging individuals to go out there and be very cost conscious about when they are receiving care for any high cost procedures or surgical procedures that they may have in the future. So we want individuals to just make sure that they are saving themselves the money as well as the plan. A lot of individuals don't realize, because a procedure isn't going to cost them anymore no matter where they have the service, that it still costs the plan more. Well, ultimately it is going to be out of their pocket, because next year their premiums could be going up because the plan is having to pay thousands of dollars more. So using these tools that are available to them on the Cigna website makes them able to look at where the best type of service that they're going to have can be. Cigna Health Coaching is something that has been available, but has only just been picking up speed. This allows individuals that are covered under the Cigna Health Insurance Program to take advantage of Cigna Health Coaches, which are nurses that can help them quit smoking, create an exercise regimen, or if they've just been diagnosed with cancer and are starting to go under chemo treatment, that this is a support system that will be able to answer questions for them, or that they can just use as a support system. It's been very advantageous for a lot of individuals, and we've gotten some very positive feedback from our membership, and so we're trying to encourage individuals to use this. It's no cost to the member, so it really is a good benefit for them. One of the things that we have available through Employees Group Insurance this year is an online portal that allows our members to go and access their benefits through this portal by registering and going in, and they can make any changes due to qualifying events or during open enrollment. They can change their beneficiaries, but it's proving to be a very good benefit for them. It's being pretty highly utilized during this open enrollment period. It'll be interesting to see what the volume is after open enrollment is said and done. So. And open enrollment is happening as we speak. Some of the things that you are able to do as employees and members of the plan are change your health care deductibles, add dependents to health and preventive dental. You can go ahead and enroll in the optional dental and the vision through VSP if you've met that waiting period, and change your flexible benefit elections also. Now, open enrollment always runs from October 1st through November 30th. We're pretty unforgiving about that November 30th deadline. We really need to have everybody submit their requests for changes by November 30th, so we have time, and all the different entities have time to set up their payroll systems, and we get these individuals enrolled in all the different vendor systems so their benefits are ready to be accessible on January 1st. Now, any dependents that are being added to the plan, they do have to submit their supporting documentation for those dependents, marriage certificates for spouses, as well as birth certificates for any children that they are adding to the plan. And those need to be submitted by December 31st. So that is all I have for you.
Does anybody have a question?
Mr. Chairman, I'm going back to slide number 12. It's probably going to be confusing for you.
Okay.
But what it is that, maybe you explained it and I wasn't listening close enough, but what is 200% of Medicare allowable for non-participating medical providers? What is the policy now? If it was if it's going to be 200, what is it now? And give me some kind of a layman's explanation of what the logic of that is, if you would.
Every procedure for non-participating docs has a given amount that is allowed, considered allowable, maximum allowable cost. And so that currently is determined by information that is gathered for that procedure in any given area. So it's a regional how they collect that data and determine what that usual and customary is. And so like I had indicated before, that it can be very much skewed by what amounts are submitted and gathered for any given procedure. So an office visit could be for one procedure for one provider determined to be $560. And then another provider is submitting for that exact same procedure, and he's charging $25. And so with that, you're saying, okay, what is the real usual and customary rate for these for that given procedure? Now, with the Medicare allowable, that is a defined an allowance for that Medicare allowable amount. Most insurance companies have been moving towards this Medicare allowable to make this determination for their out-of-network providers. And so we have made that determination to go with that 200% of that Medicare allowable. All providers know what Medicare allowable amount is, and so they will know exactly what 200% of Medicare allowable is, and they'll know exactly what they'll be reimbursed.
Can you tell us what the current percentage is? It says you're moving 200.
We're not doing a Medicare allowable currently. And so what we currently are using is trying to do a regional. It's called a Fair Health is the vendor that Cigna uses to make that determination. And so what they do with that allowance is they use the 90th percentile of what's been determined to be that usual and customary. So trying to bring into line the highest and the lowest and then the 90th percentile within that. Mm-hmm.
I had recently visited a state in which their state employees were concerned about their shopping methodology they had. What they had in place in the state of Florida was they had an ability to go online to look at what usual and customary was, and they were actually showing providers that were charging specific costs for specific procedures, and the employees could make a choice. But then it became very controversial, and those providers started dropping off,
Right.
because they weren't part of the network. Have we done that in this state, try to look at that process?
That is one of the reasons that we're moving to this reimbursable model, because it hasn't been working in the way that it was. And so we have looked at both the contractual allowance that is allowed for the contracted providers to make sure that they're not charging more than what that 200% of maximum allowable is. So they're moving to a fee schedule amount. And so with this reimbursement of the Medicare allowable, that you're thinking of it's been going out the window basically because they can't make a determination that is clear and defined for all providers throughout the country, and it gets skewed so easily, where Medicare allowable is finite. And so it can be, you pick that percentage of Medicare and that becomes more fair.
Thank you.
Next on our agenda, we have update on state revenue with Alex Kean. He is the Division Administrator for Economic Analysis of A&I.
Mr. Chairman. So I was just going to do a brief overview of the results of the October CRAG and how that sort of impacted the general fund budget reserve accounts. Overall, I'd say the report was good news. Revenue collections are trending in the right direction, and actual revenue collected in the state's main operating accounts, the general fund and budget reserve, exceeded projections by $237 million in fiscal year 2017. A large piece of this, $132.9 million, was realized capital gains through the Permanent Mineral Trust Fund. Those gains were further distributed between the LSRA and previously appropriated capital construction projects. So FY 2017 actual revenue plus the newly projected income for fiscal years 18, 19, and 20 substantially changed the flows of money as compared to when the legislature left town at the end of the 2017 session. When the legislature left town in March, the general fund required transfers of $261 million to balance the budget. That number has shrunk to $132.7 million. So $96 million from this 1% severance tax, that was a diversion that was put in place in the budget bill, and then a hard appropriation of $36 million from the LSRA into the budget reserve account. When the legislature left town in March, the LSRA had a profiled balance of $1.482 billion. Now the LSRA has a profiled balance of $1.6 billion. The funding came, the $118 million improvement was a decrease in the transfers going from the LSRA into the budget reserve, as well as the distribution from investment income. When the legislature left town in March, the 1% severance tax had a balance of $0. Now that account has a balance of $80.3 million. In other words, the full 1% severance tax is not being utilized to pay for current appropriations in the 17-18 biennium. When the legislature left town in March, the projected school foundation program would carry over $192.4 million into the 19-20 biennium. That projection is now $255.3 million, an improvement of $63 million. So from a state revenue perspective, the outlook has certainly improved since January 2017, but to put in a historical perspective, the general fund revenue more resembles fiscal years 9 and 10 than the past 3 bienniums. In fact, projected 17-18 revenue is still about 20% below the average of the past 3 bienniums. Looking forward, the report projects an additional $140.8 million of general fund budget reserve revenue over the next 3 years, so that's new projected revenue, not counting any of the actuals received in 17. And although the report does not add significant general fund budget reserve revenue, it does indicate that the biggest revenue streams, sales and use tax, investment income, and severance tax, are at a minimum stable, but more likely improving. Is there any questions?
When you say improve, how much?
So the improvements in sales and use tax, from a historical perspective, we dropped significantly, moving from 2015 into 16 and 16 into 17, back-to-back negative years in sales and use tax collection. That appears to have leveled off. We went 23 consecutive months of decreasing collections in a year-over-year comparison. That trend is reversed, and we're now adding between 9 and 11% improvement on a monthly basis. So that's significant. On severance tax, the main improvement has been in oil. Oil production, it was in a negative production curve that is leveled off and is improving slightly. And those are the 2 biggest modifications, mainly oil production, reversing that negative trend to a stable to positive outlook.
agencies, WPEA, the Attorney General's personnel section, and talking about some revisions and trying to get input from all the agencies to help us with a consistent personnel rule that everybody generally is on board with. So that's what this is.
Mr. Chairman, Commission, as Administrator Bach mentioned, we've met with over 20 agencies throughout the state, including personnel in the AG office and the WPEA and agency directors. And where this really started from was at HRD, when we're helping the agencies enforce some of the personnel rules and make sure that we're staying compliant with those rules that we have. There's been some areas of confusion and there's been areas of difficulties, and we'd like to have those cleaned up and made easier for the agencies and for the employees both. Starting with donated sick leave. Presently, the policy on donated sick leave is left up to an agency director. And as we've met with the different agencies, we've noticed that this is very confusing, and within the agencies it creates a lot of confusion, especially for the employees if they're moving from one agency to another. So we would like to be able to clarify some of that and create some more consistency throughout the state on that policy. The second one would be the reduction in force section, the RIF. We would like to put some clarification in that section. If an agency is forced to go through a reduction in force, we would like to make it a little bit more fair to the employees and make some changes in that so that it's a little bit easier to understand and include performance and not make it solely based on service and time with the state, so that some of the higher performing employees have a little bit more fair of a chance of keeping their jobs in that situation. The third area that we're looking at is the grievance and appeals chapter, and that entire chapter has created a lot of confusion throughout the state. It's written in a passive voice, which creates a lot of confusion for both the agency personnel and the employees when they're going through a grievance or appeal. So we would like to change that, as well as make some changes to how a grievance committee is formed, and make that easier for everybody involved, so that it's really clear and understood what happens through that process. And then last, we're looking at changing the definition of what a family is. There's certain benefits that only apply to family members. The state definition varies pretty significantly from what the federal definition of a family is, and we would like to change our definition to more closely mirror the federal definition so that those benefits are better understood for family members. These changes have to go through any chapter in the personnel rules that make changes to them have to be open for public comment. We're looking at doing that hopefully in January or February of the upcoming year.
How long is your public comment period?
60 days? 30 or 60 days? I don't remember right off the top of my head.
We can double check that. 45%.
45, but I don't know if that's set in stone.
I believe it is 45.
When do you anticipate this, everything going very smoothly? When do you anticipate 45 days after?
Right, in either January or February is when we'd open
February,
it up for
March.
the public comment, then you'd have that 45-day period, and then the rules would be implemented after that.
We would anticipate, if it went smoothly, probably April 2018 for new personnel.
Yep. Questions, comments?
You touched on this a little bit, and the issue we talked about last time was on the external and internal sick leave standardization, I guess, is kind of where we left it. Is that specifically been dealt with here?
Not to this point. In meeting with the agencies, that's what a lot of the concern is. And that's one of the changes that we're looking at making, is making that more consistent across the state.
And I will say that comment at the April meeting precipitated that portion of the donated sick leave discussion that we had with the agencies and the AG's office and the PEA.
Then, follow up, Mr. Chairman. Will you have a resolution at the next meeting that we have, so we know that this isn't going to be dropped?
A resolution on the incident from April?
The inconsistency that we talked about.
We hope to. We hope to have the inconsistency fixed within the personnel rules.
Okay.
And before, we will know what the change will be, because we'll have gone through the public comment. It may not be printed and published at that point, but we will know by the next meeting.
Make sure it's on the agenda then.
Mr. Chairman,
John?
specific to the complaint last April, does it necessitate a rule change in order to resolve that specific complaint?
It would not have necessitated a rule change. We did actually address that specific complaint after the meeting.
Okay, thank you.
And dealt with that with the agency.
Good, thanks.
Good.
Patricia or?
Mr. Chairman?
Yes.
Help me clarify, just, you're wanting to move the reduction in force change from a level of time and grade to using performance, is that correct?
We would like to implement that as part of the process. We don't want to completely remove the time of service, but we would like to have performance included, so that, say, one of your higher performers has 2 years less service with the state. We think it's better serves the agencies and the public and the state if we keep those higher performers regardless of time of service. Now, if there's an instance where there's no performance issues, then that time of service would come in as a tiebreaker, so to speak.
So what matrix would you use to determine the level of performance that employee has?
It would include the PMIs, the performance management inventories that are done every year, as well as the personnel files, and if there's been any disciplinary action.
And I will say, and I'll clarify, because David knows the rest of the chapter fairly well. The way that we are looking at it is when you get to the end, when the director has done everything that they were supposed to do and pick the classification, you know who the employees are. So at the very end, when you have 3 employees who are in that same classification, somebody has been here for 10 years, somebody has been here for 8 years, and somebody has been here for 6 years, that is the time the director is going to be able to take into consideration written performance. So it's not a matter of this person seems to perform better and that's who we would pick. It would have to be documented information so that you can utilize some of the PMI, or if there's disciplinary, so that if the person who has 8 years has disciplinary and an unsatisfactory PMI, you would be able to choose that person over the person who has 7 years.
Thank you.
One other question. How prevalent is, concerning sick leave, how prevalent is the need to, or how much sick leave is being donated from employee to employee?
We would only be able to estimate that. We would be able to do it probably through the payroll system and figure out total. We don't have that number right now because every agency is a little different. The larger agencies obviously utilize it more. For example, YDOT has quite a few emails that go out statewide that ask for donations. Then you have another agency, and maybe a small agency, the Department of Audit, you may never see a donated sick leave request because they just don't have the employees. So we could look at that number and get an amount of how much donation is going on. We wouldn't see the internal donations. So, for example, you could have DOTs doing internal donations. Our office would have no idea how problem with the donated sick leave is what we don't want to do is take control away from the director. That's why it's out there for the director to determine what they want to do with their agency. So that's why we're talking about it, and we haven't come to a conclusion on donated sick leave. Honestly, it's probably the most difficult one that we have on the personnel rule change. So we haven't come to a complete determination on what we want to do, because we want to make it fair so that a department head is not mandated that they have to go out for sick leave statewide or even within their agency. Right now, if there is an employee that abuses sick leave, documented abuse of sick leave, the director is able to say, no, we're not going to go out for donations for you because you're losing the sick leave policy. That's very difficult for a director to look at and determine whether that's an abuse. So we're trying to figure out a way that we can balance a director's ability to run their agency and an overreaching policy for the state. So it's a difficult proposition.
Chairman? Mr. Webb, I'm guessing it probably is, but in the proposed update to the donated sick leave, there seems to be a huge amount of confusion swirling around whether maternity leave is a legit request for donated sick leave. And so will that be addressed in that update specifically, or?
Yeah, maternity leave is covered under a sick leave. It's an approved use of that leave right now, so that'll continue.
Okay.
Further questions, comments? Thank you, Ellen.
Next up on our agenda is succession planning. This was also part of our tour around the agency. Personnel revisions and succession planning. Brenda Kelly is a senior HR consultant, and Jared Hanson, who will be up after to show some examples, will be presenting on this issue.
Chairman Emmerich and members of the commission. The state of Wyoming has had some lacking in our state report cards in the area of succession planning. What we were asked to do was kind of come up with a framework that agencies could use, and this is a very agency-directed process, but come up with a framework of how to set up a succession plan for their agency. The process that we have illustrated here, it begins with identifying the staffing needs, creating talent pools of individuals that can fulfill those staffing needs, identifying the talent pool candidates for the pools, developing the people in the talent pools, hiring from the talent pools wherever possible, and then evaluating whether that succession planning model is working and continuing through the process. So during the 2016-17 planning phase, where we do our goal setting, we had a talent inventory survey at the end of the planning form. We had just under 7,500 position responses statewide. Of course, the responses were subject to the evaluator's perspective. The survey questions had to do with the growth readiness of the employee. In other words, is this an employee that is ready to promote now? Would they need development to be promoted? Or if they're well placed where they are. The second question had to do with the risk of loss. Again, this was an employee-specific question. Is this employee expected to leave within the next 3 to 4 years? Highly likely, somewhat likely, or not likely to leave in the next 3 to 4 years. The next question was kind of a combination employee-specific, position-specific question, the impact of that loss. Would it be a significant negative impact, a moderate negative impact, or very little impact? The next question was really directed at the position itself, the job duties. Is there a successor or a group of successors already in place for that position, or would development be required, or would outside recruitment be required? The last question had, again, to do with the position, whether the position when it was being recruited, that position or a closely related position, whether they received many qualified applicants, very few applicants, or essentially no qualified applicants. So we asked these questions again statewide, and Jared is going to go over some of the data results.
Yeah, so the next step after the survey, of course, is compile the data, put together some data to provide to our agencies. So we went out in a joint effort with the personnel rule revisions, and we provided agencies with, and are providing agencies with, Excel workbooks that contains their agency's specific data. And Excel is an awesome program. What we've done is we've compiled. We have this raw data that we have taken and we have separated via tabs, which you can see, certain canned reports and certain canned tables that break down that data, that further isolates that data. I will tell you that the data that we are showing is completely fictitious. None of it is accurate data, but we just wanted to give you an idea of what we're demoing, and we do have some highlights at the end that is actual data that you can see. This first table here, as you can see, what it does is it breaks down those that are highly likely to leave, somewhat likely to leave, the risk of loss question, and it merges that data with the impact of loss, those that are significant, that would have a significant negative impact should they vacate their position, and so on and so forth. What's important to do with this data and what we've recommended and why we're showing you this particular report is this is a great starting point, I think, in succession planning. For example, when looking at this, perhaps a good starting point is looking at those 10 employees that were thought to be highly likely to leave, and should they leave, it would have a significant negative impact on the agency. So in Excel, should you double-click in that particular cell, what it's going to do is it's going to identify those specific employees that meet that criteria, both highly likely to leave in 3 to 4 years and would have a significant negative impact should they leave. This is crucial in succession planning, and with planning altogether, we hope that agencies can use this data and really form a plan around that, plan for future vacancies, and just be ready as those come. And as Brenda said, develop a plan, develop our employees that may be natural successors to these positions. In the raw data, you can see at the top there are some headers that does break down some additional fields, and I'll show you all of those fields here after a sec. We did provide tables, as you see. We've also provided charts. So this is a chart that breaks down that same table. It's just a different format. Some people are very visually inclined, so of course we wanted to provide them with something that they can use as well. This next table, what it does is it simply just looks at the employees that are ready to promote, that would need development for promotion or are currently in a good fit. Again, just like the last table that we showed, this is very important because we want to know who are our high-performing employees. We did have, for example, an agency use this data. What they were able to do is identify a large gap in our first-line supervisors and their direct reports. So as a result of that, what they've done is they have created a leadership academy that is designed and for employees to come if they want to work on their soft skills and learn those soft skills so that as the first-line supervisors, managers vacate their positions, hopefully we have some bench strength that can step in and fill those voids once they happen. These are the pivot table fields that we have provided with our agencies. Pivot tables, again, are completely customizable. We have provided the CAN tables, but the neat thing about the workbook, and I hope that our agencies are doing, is they are going in and playing with the data, pulling in some of these other fields, looking at the questions in more depth than even what we have done. This next table, what this does is this looks at, again, the impact of loss that the employee would have should they vacate, and then the difficulty in recruiting question, whether or not should they leave, what's the number of qualified applicants that they receive? Is it very few? Is it a lesser number? Do they get a fair number of qualified applicants? And again, what we're hoping our agencies are doing is looking at this data, identifying those positions, and looking for some underlying trends. Is there a trend with this particular position that has high turnover? What's the reason for that? Is it compensation related? Are there some other patterns that can be observed? So again, this data, we have provided numbers, but I think our agencies are much more able to qualify some of that data once they pull up and look at the positions, look at those employees. This is another chart. This particular chart looks at 3 different questions. This one looks at again, the impact of loss, the risk of loss, but also the successor in place questions. So we've identified those employees that are highly likely to leave in 3 to 4 years that would have a significant negative impact, but this takes it a step further and also looks at whether or not we have successor or multiple successors in place for that particular position. Again, you could even take it another step further, which we didn't do, but I hope, again, agencies are doing, and look at what's the difficulty in recruiting. Should they have to go outside to recruit? Do they receive a high number of qualified applicants? So just to give you an idea of what our agencies have received, and kind of what's going on throughout the state with succession planning. Now to look at some actual results and actual numbers, this is again a very high level, some high level statistics of what's going on in the state, but we have 19% of our workforce is ready to promote. Again, this was data from the 2016-2017 survey, so this would have been compiled or responses from this time last year. Keep that in mind. 45% of our employees are somewhat or highly likely to leave in 3 to 4 years. 33% of positions have been identified that, if vacant, would have a significant negative impact. 69% of the positions would require outside recruitment or significant development within, and 53% of recruitments receive a high number of qualified applicants. Again, this is just the 50,000-foot level. There's a lot more underlying trends I think that can be observed. What we did do, because the data, again, was subject to the evaluator's perspective, we did compare these numbers to some more, I think, factual data. For example, looking at and using the turnover data that we have, that the state always tends to hover around, at least the past couple of years. The state's turnover data has usually hovered around that 15% mark. So, for example, using that 15%, if we were to take a snapshot of the workforce presently and look at it again in 3 to 4 years, well, 45% potentially could vacate their positions, and we could have new employees in those 3 to 4 years. So we did find that that the supervisors, responses were very, very much in line with what we see from the state's perspective. Questions?
Comments?
Okay. Thank you.
Up next, we have kind of two items that we're going to merge into one. It's basically the 2017 market analysis. But up first is the non-exempt hourly requirement effective January 1st for new employees. And I'm going to, Stacy Romans is our compensation coordinator, and she'll take this section of it along with Aaron Williams, who's the program manager. And then we will have the state auditor's office is here, Sandy Urbanek, deputy state auditor, and Chris Quick, and Kat. I'm not sure who's going to talk, but one of them will probably talk after the non-exempt discussion.
Well, on that non-exempt change effective January 1st of 2018, all new hires coming in to those non-exempt positions will be required to be paid hourly. Currently, in the payroll system, they are set up as non-exempt salary. So when I'm talking about non-exempt salary, I'm referring to they're being paid the 1st through the 30th of any given month. Now, by moving these individuals to hourly, they will be paid mid-month to mid-month. So hourly paid positions are paid the 16th day of the previous month through the 15th day of the current month, and that's paid on the last business day of the current month. It'll provide agencies with more time prior to the current month's payroll to ensure that their pay is accurate. So they're being paid, instead of for each month 173.333 hours, they're going to be paid exactly for the hours that they work. So that's the change that we're looking at, and this is just referring to new hires coming in as of January 1st of 2018. This is a continuing trend with our AWAC and TPO1 employees for the majority of those employees, and some agencies have already currently moved to the non-exempt employees' pay schedule for hourly.
And I think we'll have Sandy Urbanic come up. Sandy Urbanic is the Deputy State Auditor.
Thank you, Mr. Chairman and Commissioners. We have been working with the HRD for probably about a year over this discussion. We've been looking at the feasibility to do this. What are the risks of going forward to moving non-exempt employees to hourly? And in our, we as the state auditor, we have actually brought this question to our national organization, the National Comptrollers Association. This is a trend that many states are moving to. The actual non-employee or the non-exempt employees, they are moving them to the hourly so that you have a better way of tracking their actual hours worked and what overtime hours that may be accumulated, making sure that the proper overtime requests are being made at the same time. So we agree and concur with Department of A&I, HRD, that this is the proper way of moving towards our non-exempt employees. Any questions?
Does this assist with the overpayment side of things too?
This will only be a partial solution to the overpayments. It will help with a part of the solutions. We do have an existing problem with overpayments, but much of that rests with the lack of changing statuses. When an employee goes out for leave without absence for whatever reason it is, workers' comp, whatever, many of that is a reason for us to have an overpayment. The other piece that is a problem is timesheets are not turned in on a timely basis. With that question, the state auditor's office has looked at this very closely about why are we having overpayment problems. Hourly is a part of it. The other part is the lack of change of status and lack of time cards. Time cards not getting turned in prior to the time payroll goes down. So by moving those that are in the non-exempt new employees through attrition, this will happen throughout all of the non-exempt. This isn't going to be applied to the existing. This will hopefully help that when an employee that is hourly is from the 16th to the 15th, their time cards are turned in so that the time can be entered into the system. The other thing that the state auditor's office is looking at is we are in a current major upgrade with the uniform accounting system, the HRM system. Part of that is moving all state employees to electronic time cards. And That is an undertaking we're working on right now. With that same, we will not only be moving all state employees to electronic time cards, no more Excel spreadsheets. There will be no more manual T80Js entered. The time cards will be the driver, so this will help with the fact that we're moving the hourly, so time cards will be accurate. But we're also bringing in at the same time the manager self-service. This is, I believe, the important piece in order to go to electronic timesheets. The other piece of the manager's self-service will be that we are going to have electronic leave requests and electronic overtime requests. So the managers will be able to track and know who is in on staff. They will also be able to know when time cards are missing. There is missing time card reports. There is calendaring in the manager's self-services, so they will be able to manage their staff and knowing when people are in and out. The HR payroll folks will also have access to these leave reports and to the missing time card reports. So we believe in joint effort with HRD to move people to the hourly status for non-exempt and moving folks to electronic time cards. We will be able to have a better feel on the overtime. I don't have the stats with me today, but I can get that later for you. Most of the states are all going to electronic time cards. Wyoming is behind the time. Any other questions?
Mr. Chairman, I don't know if you're the right one to answer this, but what, before this new technology you're talking about comes into being, does this have a significant administrative tracking and cost associated with it? And if so, what agencies is going to be most affected by this switch to hourly?
Currently, right now, I don't have the stats right in front of me, but we interface with Department of Transportation. Kronos is being used by the Department of Health, Department of Corrections, and the Boys School and Family Services. They already have electronic time cards, and they are interfacing that into us. The others are pretty much using Excel spreadsheets. The electronic time card today is in existence. This is not new technology. The state has had this for quite some time, actually. Our office has been using it for quite some time. We are just now moving Department of DEQ is on it. Workforce Services, Director Cox's agency is using electronic time cards. So the look and feel of ESS has been somewhat clunky, and it has aided some of the lack of adoption for the electronic time cards. However, the state of Michigan spent a great deal of money. They spent over 750 hours working with our current vendor, and they have completely revamped it. And the look and feel is there. The other thing that we will be moving forward in for tax reporting on 2008, all W-2s, well, they can get them today, but all W-2s will be delivered through ESS, and the employee will have to opt out. Otherwise, they will receive their W-2s through the ESS portals as well. So this is the proper way of going. It is a better way of administration. It is actually quite costly for the time that the supervisors and HR folks are using to track down time cards, finding out who has turned in their paper time cards. This is quite administratively wise, is a big task today. This should help, and we are following the state of Michigan's example of moving forward.
Stacy, this question may be for you or for Sandy. Can you help me understand why the hourly pay is in a different window than the salaried pay? Is there a reason that makes that necessary? And then secondary to that is, I assume that imposing this on new hires only eliminates any impact on employees, because when they go to work, that's when they get paid from that, during that time. So it's probably just a management of when they go to work, for instance, sort of issue. But why the different windows?
It's by state statute.
Okay.
9-3-101, Paren D, actually states that salaried employees will be paid from the first to the end of the month, and pay will be distributed by the last working day of the month. Those employees that are hourly are to be paid from the 16th to the 15th, with their pay distributed on the last working day of the month.
Just one follow-up. Is there any impact on the agencies administering this? I heard the pitch for the electronic time cards, and certainly once it's implemented, I'm a supporter of that. The implementation is the tricky part, as we know. But once the change is accommodated, does this add another layer of administration on the agencies to have two different time windows for time cards, those existing on the salaried and those new?
As I would agree, there will be some time card until we get the full electronic time cards coming in. There will be some administration. They'll have to make sure that they're keeping track of their monthly time cards versus their hourly time cards, because there is a difference. But I believe with HRD and our staff, we'll be working with those agencies. I believe Department of Health has moved to pretty much that way. So I think it's been a trend that some of the agencies have already started on that. Back to your second question about why do we make the decision on the new, it is a financial burden, and the harm is really onto the employee, because if you move someone from the 16th to the 15th, then it's in the middle of a month that you would make that change. And how do you fill that gap? And other states have looked at this. We brought this question to our national association, and it was quite difficult. For one thing, Wyoming is one of the few states that pay on a monthly basis. Most states pay on a bi-monthly basis. So making that shift for them wasn't quite as hard, but there's been, how do you fill that 2-week gap? Because it actually turns out to be a kind of a full 6-week transition, and it's a hardship on employees. And so knowing that and knowing the constraints of budgets in state agencies, the only other solution is like you offer them some sort of a bonus to fill that gap, but then that leaves a disparity against the ones that are exempt employees. How do you, or is it a loan? There's just a lot of logistical pieces that would have huge risk and impact. And so that is why the state auditor has agreed that moving folks to the hourly should be based on the new hires, so that it goes forward and there's minimal impact on their pay.
And I would add to that we have had the discussion on how to do it for all of the employees that are hourly current. And it is a problem that we will continue to work with the SAO's office on how to do that is the least impact to both the agency and the employee. Because if you give the bonus, that just impacted the agency tremendously, because they're having to come up with all of this extra money to make the employee whole, beyond the fact that you're giving bonuses to non-exempt employee but not exempt employee. So we have been discussing that. It's just going to take, it's a little harder of a situation to fix.
We feel the best way to do it is do it through attrition. The other piece that this would affect is not just the employee's pay, but it would also affect the fringe benefits. It would affect contributions to retirement. It would affect your insurance and all of that, because now you've shifted from this. It would eventually line up, but that first little bit, you would only have a partial month contribution for insurance, and then you'd have a different one for the next month. It would have significant impact on not just the employee, but it would actually impact the fringe contributions as well.
One more question. I hate to belabor this, and it's probably a naive question or one perhaps being asked way too late in the process, but would there be any merit in just simply getting a change in the state statute to make it a month-by-month pay, and then nothing changes? You're making a change to hourly.
Well, I guess in that respect, I mean, that is an option. However, then time cards come in after we have issued pay. So the way the payroll system works is when you're based on salary, the system already knows what your monthly pay is going to be. So it automatically makes that payment, and then time today follows your salary. So if there is vacation or there is leave without pay, that follows the pay. So if you shifted the hourly to the same, then your time cards aren't going to come in a timely manner in order to pay for actual hours. So that would be problematic.
Thank you.
Mm-hmm.
Deputy Urbanik, we have, and I'm guessing a lot of agencies do, a large chunk of our employees that are non-exempt, yet they work very regular hours, 8 to 5 every day. There's no overtime. They have to turn in leave. They've never done time cards because you're there from 8 to 5 unless you're not and you're taking leave then. So with that class of employees, how will this affect them moving forward? Will they see, do we have to start having them fill out time cards?
Yes. That's why electronic time cards are so important.
Mr. Chairman and Christine, it's going to just affect new hires coming in, though. Those
Right.
current employees will have to do those timesheets, but they won't be switched to that non-exempt hourly status where they're being paid mid-month to mid-month. They're still going to be paid for a regular non-exempt salary through the month and being paid at the end of the month. This is just for new employees coming in, moving that mid-month to mid-month.
But your new employees will have to fill out time cards.
Mm-hmm.
So we can certainly talk to you about electronic time cards now. Okay. And we encourage anyone that wants to go to electronic time cards now is the best time to do it now. And we're, like I said, Workforce Services has made that move. DEQ is making that move. Department of Insurance is using electronics. We have several agencies now using electronic. So I don't know what your turnovers are for your hourly, but we can certainly work with you on that. Any other questions?
I think this will also eliminate a lot of the manual work that our agency HR has to do each month. They won't have to enter so many transaction adjustments, which we call TADJs. The system's going to reflect exactly the hours worked so that people are paid appropriately. So.
Thank you.
Thank you. And we're going to move on to the 2017 market analysis and pay tables with Stacy Roman, Roman's compensation coordinator, and Aaron Williams, HRD program manager.
So after our revenue report, knowing that there's an influx of money, now I feel great about doing this 2017 market analysis information. No. So each year, the Department of Administration and Information, our HRD division, we conduct a market analysis where we compare our Wyoming state salaries to the market. So when I'm talking about market, it's compiled from several salary surveys that we conduct every year. And those salary surveys incorporate 12 of our surrounding states, which includes Arizona, Colorado, Idaho, Montana, Nebraska, Nevada, New Mexico, North Dakota, South Dakota, Oregon, Utah, and Washington. So the salary survey information that we're getting in is comparing salaries to those states. So that's what we're looking at. If it is difficult to find a position that is incorporated within those states, we do use some national data as well. So for the 2017 market analysis, it indicates the market has increased an average of 6.25%. And that's an aggregate average based off of all of our pay tables. The largest average increase occurs in our general pay table, which incorporates most of our state employees, and that has increased by 11.33%. 97% of salaries are on average 10% below the 2017 market, which is a significant amount of state employees. Here you're going to find the general overview of our different pay tables, the average change in the market, which is our MPP, the number of employees that this affects, and then the percentage of our total workforce here at the state. So for our general pay table, that's 11.33%, with the number of employees being 7,298, 89.93% of our total workforce here at the state. Our HPCI pay table, which is our highway patrol and criminal investigations, is behind 2.94% on average, which affects 236 employees, or 2.91% of our workforce. Our executive pay table is that 8.10% behind, 245 employees, and 3.02% of our workforce. Nursing pay tables is 2.98% behind in market, which incorporates 189 employees, or 2.33% of our workforce. And attorneys is at the 5.92%, number of employees 147, and the total workforce is 1.81%. And that's where we get that aggregate percent and change in the market, in the MPP, which is 6.25%. Total number of employees is 8,115. Again, 97% of salaries are on average 10% below our 2017 market.
Could you clarify what that means? As I pre-read the materials, I was having a hard time understanding how that interacted with a part of the report that you haven't given yet, but could you just clarify what that statement means?
As far as the 97% of salaries, so 97% of our state workforce is on average 10% behind on market. So comparing actual employee salaries, so all 8,115 people, 97% of those are an average of 10% behind in market.
Appreciate it.
Absolutely. Sure. Since the general pay table, which is about 90% of our total workforce, is the majority of our state employees, that's the pay table that we brought in to kind of give an example of that number behind. So these are all of our pay grades in our general pay table. By each pay grade, you're able to see the percent change in market, or how far they are behind in market, as well as the number of employees that fall within those pay grades. Which the average change in market there is that 11.33%, and 7,293 employees fall into that general pay table.
I'm having trouble understanding what's meant by percent change in market. You don't mean that this is a 1 year over year change.
Yes, it is. Yes, it is.
You know, you just don't find the statistics.
And that's comparing the MPP from last time, comparing it to our MPP currently. Our MPP, which is the market.
But
last year, and what that means is we haven't had pay raises for employees. So last year, we were 7% on average behind. If you remember, Lori Eikheim gave that same presentation, and we were at 7% there. Because we haven't done anything for the 3 years, we're continually falling behind. So that's why now we're at 11.3% instead of 7%, because there's been a change of 6%.
And Representative Madden, Chairman Emmerich, I think where we're looking at this percentage change, the current pay tables that we have since last year, Lori Eikheim presented the new pay tables, but we didn't recommend moving to the new pay tables. What we need to look at when we're looking at this data is we are actually currently operating on market pay tables that were actually created off of 2014 data. So this percentage change in market from the current MPP that we have isn't a 2016, 15, 16 data. We're actually 13, 14, comparing it to this most recent October data. So that's where the percentages are coming from.
I think I understand it now. What this, rather than a one-year movement, it's really kind of a cumulative change that just keeps building the longer we freeze wages, right?
Yes.
I mean, so you can't attribute all that 12% to just what happened in 17 or whatever it was, right?
Right, that's a percentage change from our current MPPs to the proposed ones that we're asking to move to, keeping in mind that the ones that we're currently operating on are from 2014.
Right. Okay. Okay, good.
This chart indicates where our state employees are falling as far as the market goes. That line where you see the 0% is our market, so that's where the MPP falls. So you see 97%, or 7,874 employees, are below the market rate, which is the MPP. And 3%, or 241 employees, are at or above market. So, and you can see by the different shapes where, and this is based off of the pay table. So when you look at the left-hand side of the screen, you're looking at the lowest pay tables. To the right-hand side of the screen, you're looking at the highest pay tables there and where those pay tables fall. Okay. One of the things we are looking at is trying to proposing new pay tables for 2017 instead of being behind in 2014 pay tables, an increased or shift in the MPP of those pay tables, which would also shift the minimum and maximum of those pay ranges. The percentage of change in the market determines the percentage of change to the MPP, and this is on average of each pay table, which I know we already went over these percentages, but those are the averages that those MPPs of a range would shift. And it's not precise, but it's based off of each pay grade, but those are the averages there.
And where Stacy's talking about, we're recommending the change to the MPP. The way our market methodology works is once we establish that market average where we should be paying our state employees, the minimum is 20% below the market policy position, and then we calculate 20% above the market policy position to get our maximum of our pay range, and that's how those pay ranges are created.
So this is where the humdinger is, where we talk about. So if new pay tables are approved, 1,918 employees, or 24% of employees, will be moved to the new minimum. The approximate cost of the move would be $4.1 million. That's indicating that those individuals are below the minimum, and they would be brought up to the new minimum of the ranges, the new ranges. The top 5 classifications most affected by the move to the minimum is that HSHS 04, the Human Services Aide, our correctional officers, social service workers, probation and parole agents, as well as the Office Support Specialist 1. And going below the Office Support Specialist 1, it's a lot of administrative staff that falls into that as well.
Stacey,
Director Cox.
on that slide, So 1,918 employees, if this pay table, if this new set of averages or new market policy position were implemented, just under 2,000 state employees would be below the minimum.
Correct.
How far below MPP is the minimum?
20%.
20%, thank you.
So, and then we also ran numbers on what if employees were moved to the MPP. So 7,717 employees, or 95%, would be moved to the new MPP. So that's saying that 95% of our employees are below that MPP. The approximate cost we did not include. It's highly significant. And where I included some disclaimers at the bottom, the calculation of amount is based off of October 2017 data. Recently, we had some changes in our correctional officer salaries. So that $4.1 million would be a little bit less because we did implement some salary changes to our correctional officers recently.
And I would just make a comment too, the comp policy requires employees to be at minimum. They can't be below, which is why we put that number in there. If you do change the pay tables, those employees would have to come up to the minimum. And at the minimum, they would have to come up to the minimum. And then that would be, I think we figured with the correctional officers, somewhere between 3.8 million off of that number.
Yes.
Comment?
Chairman Emmerich, when you're looking at the top 5 most classifications that would be affected by movement to the minimum, we also want to point out that those are also our highest turnover classifications. So what we're hearing from agencies, and this goes for all of our classifications, but definitely very prevalent in these classifications here, they're high turnover and they're our furthest employees away from market. They're our lowest paid employees we have. So we're continually spinning our wheels, turning over, training new employees, all for them to leave. So it's a very continual process. The numbers that are kind of disturbing to me, in Jared's and Brenda's presentation when we did the talent inventory survey, we are finding now not adjusting the pay tables is affecting our agencies as far as that turnover. So knowing 45% of our employees could potentially leave within the next 3 to 4 years, on the recruiting side, my staff works with recruitment, so we're trying to do preferences and help make sure that we're recruiting the appropriate people into those positions. But we are hearing on a very regular basis, supervisors are getting applicants, they're selecting their top candidate, and they're getting turned down because the salaries are too low. So managers are not hiring the most qualified employees to come work for the state. A lot of the times when they're making these offers, they're their 3rd or 4th candidate down. So by not adjusting these pay tables, we're affecting our succession planning, our turnover. We're not getting those qualified applicants in because the salaries are just too low. We even have heard most recently from one of our agencies, they hired an employee who's worked with them 6 weeks, and they're leaving to go take a very similar position outside state government, making $20,000 more a year. And so even if we're getting them in, we're not even keeping them 3 months.
Needs to hear this, or you probably talk to the executive branch about this is budget time right now, and I don't know how else. We got to do something with it. See that? I mean, we were in this pickle about 10 years ago.
Right. And also with that, we're looking at severely high turnover costs with these employees leaving. I don't have the exact cost, but we could get the information to you. It probably would be cheaper to move it up like this than to keep paying for turnover like we are. So.
Yes, indeed. Yes.
I know this has been addressed many, many years ago, compression. So how does this assist with the compression? How are we moving with compression? Does it help eliminate it a little bit more? Are we still going to follow the same trail as we've done for, as Dean and I know, years and years and years?
Mr. Yerketty's commission, I think one of the issues with moving the pay tables will definitely bring into consideration some compression. And so along with our recommendation, when we were giving the market merit increases, the 3 years that we did that, we were starting to really eliminate that compression. So along with the recommendation of moving the pay tables, to ease the compression and keep that separation, we are going to need to, relook at implementing that market merit matrix as well, and moving those employees that won't move to the minimum as a result of the pay table adjustment, and keeping those employees moving through the ranges as well.
And on the last chart here, you'll see the 10-year history of increases for our state employees, going back to 2007. It started in 2007. There was a 5.5% increase, going down from there, 4% increase. As you can see, 0% increases along the way. I know in 2013 there was a 1% retention bonus for employees as well. That's not included on there just because it wasn't actually an increase to their pay. It was just a one-time bonus for employees. And then going up from there, 2014 saw that 2.38, 2015 at 2.93, and then since then it's been at that 0% increase.
Commission, I would add as well is during this time too, we've also had some, as you heard from Pam Unruh, we've also had some increases on employees for retirement and insurance. So when they're not getting increases, they're actually getting pay reductions because their benefits are going up as well. So I just wanted to make sure that was clear as well.
And that's all I have on the market, the 2017 market. Thank you.
Questions?
So if there are any further questions for Stacy on the market analysis, we can go to the employee request for review. However, I was informed that there are a couple people who are requesting public comment at the end. So if you would like to anticipate public comment without written comment, I can have them either come before or after we read the employee request for review.
To the request, and then we'll get to public comment.
Okay.
Okay. Well, we'll start with the first one that comes from the military department by the employee name of Misty Malmberg. There is a serious need for fiscal and purchasing positions to be reviewed throughout the state, but specifically in our agency. For example, I do the budget for the entire agency, and I am classified as a level 10. At all the other agencies, my position is an 11. My accounting manager is at a level 9. At all the other agencies, this is a 10. Within our own agency, we have level 7 accountants doing a higher level of work than level 8 senior accountants in a different department within our agency. Our agency HRO has asked HRD A&I to do desk audits and has been told they won't do a complete desk audit within our agency. How can we get this problem resolved? It is not about money. We know that there is no money in the budget. It is about being classified correctly. I would
would inform the management council
And I assume with this.
That the survey data is new. We've only received it in the last few weeks. The governor is building the budget, which needs to be completed this week or next week to get to printing. So the timing is not ideal here to impact the Budner's office knew that we were 7% behind market. We did not change the pay tables last year, but as you've heard, there's significant reasons why we need to consider changing the pay tables. It's affecting recruitment, it's affecting retention, and essentially employees are losing ground with their pay. So I think that the commission can endorse changes to the pay table. The question would be when and to how much. And if that does not come during this legislative session, it could come next year or it could come sometime in between. But I think what we're trying to do, and this has always kind of been a problem in HRD, is that the salary surveys are always conducted in the fall. And we've talked with the compensation folks about how that doesn't work so well with our budget cycle. So again, we're coming in towards the end here of the budget prep cycle, making a fairly substantial recommendation, potentially making a fairly substantial recommendation that could have a budget impact. So I think the commission can endorse, if you choose, you could make a recommendation to endorse changing the pay tables. That doesn't necessarily mean that they will go into effect soon or in what manner, but that would be a step in the right direction, saying that you recognize that there's a problem here, and maybe there has to be some further analysis to come up with some different alternatives. Maybe we don't do all the change at once. Maybe we do it in a graduated fashion. I don't think you have all of the information to make a complete recommendation to the governor because you haven't heard options. You know, one option is to raise everybody to the MPP, but as we all know, and this has been my concern, and I've been expressing it to a number of legislative groups and folks, my concern is when Mr. Yerkes and I worked in human resources, the state spent a fairly significant amount of money doing what we called the Hay study. And that was about 7-8 years ago. And what we found is we're going kind of a complete circle here again, although I don't think is quite as bad today as it was 7-8 years ago. Employees were not classified correctly, and there was not a consistent rate of pay. So we ended up doing the Hay study, which looked at getting people properly classified and then building pay tables, which we have today. And 7 to 8 years ago, we had the same statistics where we had about 2,000 people that were 10% below market. And so we've gone full circle in 7 years. Even though we implemented the Hay study, the message is that our pay raises have not kept up with market. So we're back to where we were 7 years ago, where 2,000 employees are below 10% of market. And we've actually adjusted the pay table in that time period. It used to be 15%, and then we reduced the minimum to 20%. So here's another one of your options, is keep changing that pay table. But this is not an easy solution that I think you can make a decision for today. I think you need more information, certainly more dialogue with the governor's office, but I think the message that I'm trying to communicate is that in the last 7 to 8 years, we've created a compensation policy, philosophy, and a pay structure. And if we're going to adhere to that, we're going to have to keep making changes to our pay table. So I realize the state is in probably not the best of financial situations right now to make this change, but I maintain that a year from now, when you come here, if we don't make changes to the pay table and eventually employees with their pay and their benefits, you're going to see, instead of people not getting their third and fourth pick, they're not going to be able to get their sixth and seventh pick because we're just not competing with the market. And then additionally, I think we all anticipate that the cost of benefits are going to continue to come up. And there's, I think most employees understand that they're going to have to bear a fair amount of that cost. So with no pay raises and increase in their contribution to benefits, we see that their take-home pay continues to go down. So I think, even though Jared told you our turnover rate was 15%, edging around 15%, I think if we don't start addressing these problems, you're going to see higher rates of turnover in state government. You're not going to be able to retain your brightest and best employees, and you're certainly not going to be able to recruit the best employees to work for the state.
I was going to just say, Director Cox, would you like to rephrase your motion?
I think so. I'm going to try to do this on the fly, so it may need more work. But, Mr. Chairman, so in rephrasing the motion, I would make a motion that this body endorse the adoption of the 2017 data into the pay tables and further endorse consideration in future budget deliberations of actually implementing that into the pay of state employees. Mr. Chairman, I don't know if this is part of the motion or just supporting comments, but I think we all need to be sensitive to the fact that the state budget, the revenues are down. They haven't come back to where they were. We do have some signs of hope. That's good. And I would also call attention to the fact that the legislature has worked very hard to right-size state agencies. I can't speak for other agencies in the room, but our agency is north of 40 positions fewer in the agency today than it was just several years ago. So the right-sizing of state agencies, and that might be a generous term, the downsizing of state agencies and the attempt to bring budgets in line with revenues has had an impact on the ability of agencies to deliver services. It has rightfully caused us to carefully consider what we do, how important it is, what the priorities are, and to make some very difficult choices. And I think the legislature's been certainly involved in that as well. So with that in mind, I think as justification for the motion, I think it's just important that this is taken into consideration going forward, because there's probably not a state agency represented in the room or listening into this that isn't smaller today than they were just a few years back. Thank you, Mr. Chairman.
So, Mr. Cox, your motion, if I can get to the heart of it, is this board, this commission recommend to the governor and management council, due to lack of retention and inability to recruit at the 2017 pay scale, come into discussion as we budget.
Mr. Chairman, the only clarity I would give to that, you said it far better than I, and that's the voice of experience talking right there. I think in deference to Director Fawcett's counsel here, I'd move that we endorse the adoption, and then further that we take the results of the 2017 survey into consideration in future budgets.
Much nicer, like that. Patricia, have you got kind of a succinct?
Yes.
Okay. You're okay with that?
Yes.
Second,
Great.
Representative Madden?
Yeah, I do. That's well, I second it, and I think it's important that, you know, if it isn't done this budget, you know, in the next 2 weeks, obviously, you still got the same sitting governor still has another budget to do next year, and it might be further to the top of the priority list in a non-budget year than it is this budget year. And so I think it's important that the executive knows our position on this, and we understand the impending turnover risk that we have. And so I fully support this.
Discussion. Discussion. Stacy, or Patricia, could you kind of run that back to us?
The commission endorses the 2017 pay tables and would like the governor and management council to take results of that market survey into consideration for future budget cycles. Is that succinct enough?
That's good. All in favor of that Motion, say aye.
Aye.
Opposed? Thank you, Rita. That was unanimous, by the way.
I think we'll move on to employee request.
Yep.
The next employee request comes from Reed Avazian. He is with the Wyoming OSHA Department under Department of Workforce Services. To whom this may concern, I am writing to explain my request for review as I will be unable to attend the commission meeting on November 17th. I have been a part of Wyoming OSHA's consultation program for almost 2 years. Prior to working here, I worked as an environmental, health, and safety manager for a conglomeration of businesses for 1.5 years as a private health and safety consultant for about 6 years. I came into this position with numerous certifications and credentials, the most prominent of which are the Certified Industrial Hygienist, CIH, and Certified Safety Professional, CSP. These designations symbolize the highest level of achievement in health and safety, respectively. I am aware of only one other individual within the state that holds both the CIH and CSP. I have submitted this request for review because I feel compensation for my experience and credentials is not being offered. The state of Wyoming is currently offering $49,536 to $61,920 for the senior OSHA specialist position. There does not appear to be a junior or associate level as everyone has the senior title. This pay range is on the low end of what safety technicians can be paid in industry. Technicians are individuals with little knowledge or skill in recognizing, anticipating, or evaluating hazards or in developing controls. Typically, they will inspect equipment using checklists given to them and process paperwork. OSHA personnel are expected to perform above the level of skill, so compared to industry, the state's pay range is very low. In addition to the normal pay range being low, individuals with certifications are offered an additional 10% above the range listed above. This equates to about $6,000 per year as compensation for extreme amounts of time and effort to be put into obtaining and retaining these credentials. As the attached documents attest, in industry, these credentials boost an individual salary by about $22,000 to $30,000. Having both the CIH and the CSP boosts the salary even more. I feel like our starting point for pay is on the low side, but our incentive for individuals with credentials is basically non-existent. To help support the claim of people with my experience and credentials, I have included a few reference documents outlining what an appropriate salary would be. The document entitled Results of the Industry Compensation and Benefits Survey comes directly from the ABIH, the organization that administers the CIH credential. This document, using 2015 data, shows an average salary for someone with either the CIH or CSP as $105,000, and mentioned individuals with both receive even more. The document from PayScale shows salary ranges for the types of jobs individuals with these credentials would hold. The industrial hygienist listed first is basically exactly the same as my current position and has an average salary of $90,000. The next 2 lines on this document are the types of positions competing for these credentialed individuals. The document entitled 2015 SH&E Industry Salary Calculator is a system the ABIH created to calculate recommended salary based on your own experience, credentials, etc. Having input my own profile as closely as possible, some groups such as geographic location, Wyoming, did not have sufficient data to compute, suggest an average salary of $92,800 with an additional $8,500 in other compensation available. My current compensation would put me somewhere around the 15th percentile for pay for people with similar profile. As you can see from my performance reviews, I have received almost perfect scores and am highly valued by my manager. Given that information, I feel that being paid around the 15th percentile is dramatically inappropriate and that at least the 50th percentile should be achieved. I am bringing this matter before the Commission as I feel that sending it through my chain of command has been ineffectual. My immediate supervisor refers the issue to her supervisor, Daniel Bulkley. Mr. Bulkley has repeatedly told me that he supports a pay increase, but that A&I limits what can be given. Additionally, this pay increase that Mr. Bulkley refers to is a blanket increase for all OSHA personnel. Being the only senior OSHA specialist with credentials such as these, I feel I should be compensated above the level of my peers to account for the additional experience and education. I do not feel that a 10% increase over my peers reflects the value that industry places on my credentials. I am respectfully requesting that my salary be increased to $101,300 to be consistent with the median compensation plan industry offers for my experience, qualifications, and level of performance. If there are any questions, please contact me. I appreciate you taking the time to review and consider this request.
And again, we will be investigating that information, getting a letter together, and then have it sent out to all of you for review.
Documentation here.
There is considerable documentation attached to his.
If you would, please proceed.
Yes. Next up.
Okay, the next one comes from Cherie Howell with the Department of Health. Our staff is constantly getting hurt and no consequences for our patient. General attorney will not hold them accountable for their actions, and jail has refused to take them. We have more staff out on workman's comp than we do working. We are short on the halls, which makes it unsafe for staff and patients, which makes our quality of care go down. We have administration on call that has refused to come in and help. CNAs were switched to 12-hour shifts to help with the shortage. This change has caused more problems than they help. 27 plus staff have quit within 2.5 weeks due to the change by the way this change was put into place by administration. Pay raises. CNAs have not had a raise in approximately 5 years. Why has the state approved another building to be built? Cost of living has gone up in Wyoming. Text plans are put in place by providers. For example, directors, social workers, psych managers. They do not follow their plans. CNAs try and follow the plans, and if we don't, we are reprimanded and our patients take us as the bad guy. Our panic system has been down for quite some time, and no one seems concerned about fixing this issue. I feel that we talk and no one listens to our concerns, so it makes it hard to trust anyone at the hospital. We work at an unsafe place.
Once again, we will investigate that and produce a report back to you for a letter to the employee.
The next one comes from Misty Hill. She's also with Department of Health. Here at the hospital, all salary staff were switched to hourly. We were only given 3 weeks to make up 50 hours to cover our October paycheck. We were not only switched to hourly, but they changed our shifts to 3 12-hour shifts with 3 days off. We asked if we could do 5-5 or 6-6 because this would help the single parents with daycare and being able to spend time with our kids. Other coworkers and myself had to rely on each other for childcare, so we were unable to make up the 50 hours. I am a single mother of 4, and my October paycheck was only $1,000. It would have been nice if they would not have done these two things at the same time. They came to us all about a week and a half after telling us about the changes that would start October 1st and said we could hold off until November 1st. By then, we had all changed our life schedules and had already started doing overtime to cover the 50 hours. The safety system does not work properly and puts us at risk. We are short-staffed on the halls, and the clients know. They watch and see how many staff are on the halls causing problems. A lot of the time, there is only one person left on the hall when the other staff get called to a safety team, issues with other clients, or the nurse has to do the meds. The doctors write treatment plans, but them and some of the treatment team do not follow it. The inconsistency with treatment plans is a real problem. People are getting hurt because of this. The clients state often that they can hurt us and nothing will happen to them. When they moved us to these 12-hour shifts, they said it was because of safety. This has not helped the issue. We have less staff to work the halls now than we did before. The lead scheduler is so overwhelmed is not getting help from the manager. I cannot even remember the last time the CNAs got a raise. I have been here for more than 9.5 years and have been working as a CNA for 14 years, and some of the new staff gets paid more than I do. The nurses got a $6.75 raise and we got nothing. The upper management and doctors do not value what the floor staff suggests or what we have to say. In this hospital, you cannot accelerate.
I will make one comment on this one. This is an example of the non-exempt exempt issue. The department, from what we can understand, did move some in direct care that created this issue. This is the issue that you would have if you went across the board with current employees. We are currently looking into this and figuring out how many of these people they did it to in the department, and we'll have a thorough report on what happened there. So we'll get that back to you as well. But that is the example that the auditor's office discussed and Stacy discussed on why it's problematic.
The next request comes from Lawrence Pavone Jr., who works for the WYDOT Highway Maintenance. I have been miscompensated for the last 5 years, I believe. My pay rate does not match that of an average employee that performs the same tasks that I do. Since I started, there have been 5 new employees that have started after me. Each one of those individuals have received a higher compensation than what I receive. I have missed out on a significant amount of money because of the issue, and I feel that I am entitled to this. There are 3 sections that are in the compensation policy. General Procedures, Section 2, all employees being paid within the pay ranges established. Section 5, Requirements for all pay adjustments. Internal Equity, Section D, III, Internal Equity. Number 1, Agency Average of Actual Pay for Same Class. 3, Average State Pay for Same Class. The average for August 2017 is $17.78 an hour, or $3,081.50 monthly. I am at $16.68 an hour, or $2,889.65 monthly, and employee ID is presented.
Again, we will look into it and produce some information for you to get back to them.
The next request comes from Tony Hawks, who is with the Wyoming State Hospital as well, Department of Health. The panic system. The system has not worked in over 2 years, really longer than that. It has never been able to locate staff that are in need of help. It has always read it wrong. But no, all we have are alarms and a 10 seconds, if not longer, delay, which means that staff can and have been put in a very dangerous situation. Staff does respond to the alarms, but has said that the best way to communicate in the situation is to scream. When IT, administration, and security has been asked why it is not working, we are told, it is an old system, it can't be fixed, or we have done all that we can. This has been going on for over the past 2 years. All this says to the staff is that we don't count and we can be replaced. Number 2, as everyone knows, we have been switched to hourly pay. Also, all the nursing staff have been switched to 12-hour shifts. They say that this will make everything better and that we will have more staff and less call-offs. What we have seen are more call-offs, not enough staff. We are now working at emergency acuities. Since I am under nursing but not counted into acuities, if they are short, I have to go and work the halls and I'm not able to complete my job. I do not mind helping when things are so low. What I do mind is we have 2 nursing supervisors at APS who, for the most part, sit in their offices behind closed doors. I understand that they also have work to do, but we have been told that we are all a team and client care comes first. But this only seems to go for the frontline staff. Number 3, our supervisors and the DON has told all the staff that there is not to be any food down the hall for the staff because this is a patient care area. All of the APS is a patient care area. We have groups and clients that are all over APS at any time. But the only people, again, this applies to are the frontline staff. Supervisors on a regular basis have full meals at their desks. We have had staff written up because they were eating at their desk. You cannot have a double standard. You should be leading by example. What most of everything that I have mentioned comes down to client and staff safety and consistency. I know that we are always going to change and things are not always going to work out the way that everyone is hoping and planned. We are all here for our clients, but we also have to be here for each other and be a team. But teamwork only works if we all work as one. Do not tell your staff I will not work the halls. This is not my job. We all have the same training from the administrator: ground crews, housekeeping, transportation, security, ADON, scheduling, HR, CNA, nursing, etc. Everyone that works at the state hospital can come and help out on the floors so that we can provide the best quality care for our clients, but also ensuring that we do not have staff burnout and complacence. Thank you for your time, Tony R. Hawks, Hall Clerk.
This again includes her second complaint was the change from non-exempt to exempt. So we will include that with this one as well, along with the other complaints.
The next employee request is from Paul Herseg, who works for the Department of Workforce Services. Members of the State Employee Compensation Commission, I request your time, please, to review the attached pay increase request that was denied from ANI HRD. I have requested my one-time retention bonus after accepting and later rescinding a job offer from the Wyoming Judicial Branch at the Wyoming Supreme Court. In my opinion, DWS has followed all the rules and processes for this request through the agency, though the agency had numerous roadblocks that caused a lengthy delay. Their persistence with my request was another reason why I decided to stay with the agency for less pay than I was offered at the Wyoming Supreme Court. The agency originally submitted this request as a normal pay increase to MPP because they didn't want me to burn my one-time bonus and they weren't asking for above this rate. The request was denied due to average pay across the state and my class code. The agency then submitted this as a retention bonus, but then was told they didn't have the funds in the budget. I think I cut off some of that at the bottom, but there are several documents also explaining his complaint there as well.
In our packet.
Again, we'll investigate this one and get back to you for information to the employee.
Okay, and the last request for review comes from Michael Garner with the Wyoming Department of Transportation. My question is why principal engineers at WYDOT are paid substantially less than principal engineers in other state agencies, most notably engineers at the DEQ. One of the arguments is the level of responsibility. I would like the Commission to specify what duties a principal engineer at DEQ does that is up and above the same position at WYDOT or even equal to the duties performed by principal engineers at WYDOT. I have been working on this topic since the inception of the Hay Study in 2009. I have received two nearly identical letters from Patricia L. Bach dated March 2nd, 2016 and June 19, 2017, and have yet to get what I feel is a satisfactory answer. Also, why are the agencies still advertising job openings with salaries that are unattainable? Is this ethical or legal? Thank you for your time.
Mr. Gardner has written a few other times, and we have I think 5 responses. My prior HRD administrator, I think I have a couple from him as well. We will put that all together and make sure that you have everything you need when we respond again. Probably the first week of December. We'll get you all of that information. I will get the letters all done. A lot of these we have already investigated. So we will try to do that first week of December after the Thanksgiving holiday.
Mr. Chairman, is the difference in pay between these two agencies partially explained through our salary surveys or not? I mean, I assume there are two different types of engineering degrees. And I remember when I was going to school, some engineering majors made, more money than others.
Correct. In this case, it goes back to the Hay Study that was implemented. DEQ had a higher level principal, and WYDOT had a lower level. And what happened is the Hay study brought the DEQ higher level into YDOT's principal engineer level. So they were paid more because they were at a higher level, but they wanted to combine them in that, I believe it was a 9, is that correct? Director Cox actually might know this answer too. So that is the essential reason why those employees that are still in that classification at DEQ were paid slightly higher. The letters that we have will indicate exactly what the process was, and you can review that as well. But that's generally where the problem came.
Commission, any questions, comments, statements before I open up to public comment? With that, we are now open for public comment. If you wish to speak, come down, state your name, rank, and serial number, and your concern.
From WSP. This is Corporal Casey Murzak. He's also from WSP. We really just want to talk to you about the issues that's going on with the staffing at WSP right now. And it's going to go back into what we were talking about earlier. I don't want to beat a dead horse, but we do have some information coming from that facility. So with your permission, we'd like to give you some handouts, if that would be okay. So first I'd like to start by telling you a little bit about Rawlins. I don't know if you've ever been there. It's a very small town, but the cost of living there, and this, you can find this on the computer, is 1.7% above the U.S. average. Most of it coming from housing, a lot of it coming from health and transportation and miscellaneous. The median rental in that area for a one-bedroom apartment is $1,080. So for the new CO coming into our facilities, and I don't know what the new pay rate is, of course, but with the old pay rate, their take-home was $2,200 after taxes. $1,080 is half of that pay. That doesn't leave them much to live on. So they have to do the overtime. And this is 12-hour shifts. And that can get very stressful at a prison. So just some statistics. Also, the future job growth in Rawlins is projected to increase by 40.36%. We have the windmills coming in. We have Sinclair hiring. There's a lot of competition there, and we're losing a lot of people to that because of the low pay. So I think we brought this up earlier. Miss Aikem? Is that how you say your name? Isham? Okay, she mentioned that she believes the lower rate of pay was already affecting the retention of staff. We put together a list of staff that were hired at WSP for various reasons and are no longer employed. The data from just the last 3 years show, and you guys have that graph on your paper. In 2015, we hired 36. 41 of those left. We were remaining with a -5. 2016, we hired 33, 38 of those left, still -5. This year, we hired 25, 49 of those people left, that leaving us with a -24. We're losing more than we can get in there. It is at the point now where I don't think if we didn't have WMCI staff coming in and people from the other facilities, we wouldn't be able to run the things that we need to run in a prison. And that's the truth. And we have anywhere from, 1 to 13 WMCI people there on any given day. So these numbers reflect the staff that made it to shift, that I'm aware of several staff that were hired but quit before they made it to shift for a better job. These aren't just new people. Some of them have over 10 years of service. We just lost another one who his last day is December 1st, and he has 10 years of service, and he should be staying. There was a market analysis conducted in 2016. The results show that the market has increased 6.91% for the staff that fall into the general pay scale. Of the 8,189 staff employed by the state, 7,371 of them are affected by the 6.91 increase in cost of living, which covers over 96% of our workforce. So I'm going to turn this over to Corporal Merzak.
Mr. Chairman, the information that I gathered just from talking to staff and based off the last raise that was the Director Lampert recently put out for correctional officers and correctional corporals, they put a blanket, is what I would call it, as a blanket fix on the salary. They gave all the new staff, all correctional officers, the bump up to $18.25 an hour. And correctional corporals, they bumped them up to $21 an hour. Some of our most senior staff, the ones we look at for our leadership and guidance and to train future staff, got 3 cents, 20-cent raises. And they see the newer corporals that have been there for 2 years get, some of them were over $2 an hour raise. This isn't based on the Department of A&I's objectives for compensation. I don't feel like they don't stand behind their statements when they say they're trying to motivate the loyalty, retention, and contribution of their employees when they're not giving raises to their most senior staff and trying to keep them on. They also say that they're trying to, or they want to create and maintain an internal equity among positions as measured by a defensible method of job evaluation. Most of the PMIs that were given out, and I'm not making this about PMIs that were given out, staff would receive the same evaluation, and yet they didn't get a raise to show that work or the dedication they've put towards the department. Only the newer staff. So, and then on top of that, there's no incentives to promote and to advance yourself within the department. You'll have officers going to a supervisory role getting $6 a month raise, sometimes none at all. So there's no incentive to advance your career or look at staying when you're not getting a raise but once every 8 years. The last market analysis that was done, or the raise that was given in 2014, some staff were already at that lower 20% below, so they did not get a raise. And now they're looking at the 2017 market analysis and looking at pushing out another one. How many of those staff are going to fall in that same category where they're 20% below and not get another raise? There's no incentive for someone to want to stay here. Sergeant Mayer gave you the numbers for the staff that we've retained over the last 3 years. You have them on page 3, 4, and 5 that I gave to you. And highlighted, or the bolded names, are supervisors that have left, some of them with 10 plus years of experience. We can't continue to lose staff to the rate we're losing them with the experience and the knowledge they have to pass on due to salary, when it's something that can be fixed. I know we haven't had a budget to rely on. However, even back when there was a budget where we could have given raises, one wasn't given. The staff that did get a raise, the 3 cents, they just learned not even a month prior to that, the insurance costs were going up. That absorbed any raise that they did get. So someone had shown earlier a graph for our total compensation, and I punched mine into the website before I came down here, and it shows that my total compensation would have been $6,596. The job market for similar entities, they have benefits packages, they have the insurance, they have other forms of retirement that are competitive, if not more. they always have a better pay or a better insurance package. So when you're bringing in new staff and showing them this is your total compensation, they're not able to live off that total compensation. It's only half of that, which their base pay is $3,200 at the time when I filled this out.
Mr. Chairman, I think what you're talking about is some wage compression or something as far as.
There is wage compression.
And we had the prison, the Rollins prison on our agenda a year or two ago, and that was more on, they couldn't get people to apply for the jobs, right?
I believe so.
Yeah. Did we?
And on housing as well.
Pardon?
And on housing as well?
Yeah, and the housing was a problem, and we did add some salary for that, didn't we? Or didn't that make it through the executive office to?
I believe the salary that they're talking about is the most recent approval of CRPO 5s. And Brenda Reedy is here, so she can probably explain that as well. And she's the HR manager for the Department of Corrections.
Oh, okay. I'm sorry. Okay.
Mr. Chairman, members of the Commission, I'm Brenda Reedy. I'm the Human Resources Manager for the Wyoming Department of Corrections. And Representative Madden, you are correct. We've talked about correctional officers and our challenges for many years now. And recently we were able to do some pay adjustments, like just effective in October of this year, to increase some minimum salaries for our staff between all 5 of our prisons. But we were only able to, within our existing budget, we only had enough money to do adjustments for our correctional officers and our hiring rate for our corporals. So that has created some pay compression issues for longer-term corporals who were already above the pay rate adjustment that we made. And then for the rest of that chain of command, when you look at sergeants and lieutenants and captains and stuff, we weren't able to actually afford within our existing budget an adjustment for them. And we have noticed a change in the number of applicants we're getting for our correctional officer positions. Over the last, I would say, 2 to 3 years, we've had a decline in the number of applicants for the job. Or you might see a lot of people looking at the job, because you can track that in NeoGov as to how many people are looking at the job, and then how many people actually follow through with the application process. About 10 years ago, it would take 4 applicants to fill 1 position. Now we're looking at, we need to get 6 or 7 applicants to fill 1 position because they just don't follow through or finish the process to become a correctional officer. So we've noticed a trend within the last 5 years where we are losing more staff than we're hiring, and we're needing more and more people in that pipeline to even fill a single position. So it's become very challenging. And then we get them on board, we send them through 9 weeks of training, they get out in the facility, and then Sinclair Oil Refinery is hiring for twice the salary they can make with us. It's really difficult for them to say, oh, I want to work inside a prison and make half the money that I could make in my local area. So it's kind of this perfect storm of issues coming together where our salaries are low, we haven't adjusted them except for this recent one. We have oil on the upswing, we have wind energy coming in, so we have lots of job growth in that area. And then housing prices continue to go up as a result. So now I can't even afford to live there. I've heard a lot of officers talk about the fact that they have to live 2, 3, 4 people in a place just to be able to afford the cost of living in the area. So it's a lot of factors that are coming together, and the compensation is a piece of that for sure.
it out a little bit. And I think what Brenda said is succinct on what happened for the October increase, and it will create compression as the officers, sergeant was describing. So that is an issue, but they were working within the budget they have right now. There's not much they can do over and above what they have. So I think they were doing what they could, but it's something that has to be fixed in the future.
Mr. Chairman.
Yes. Representative Biden.
All of your remarks, I think all three of you, and what you're saying too, Patricia, we're really talking about Rollins. We're not talking about the whole system, right? Now, when these adjustments you were talking about that are coming in or have come in, not only in the past, but in just the immediate past, do they go agency-wide, or do they just focus on where the problem is? I mean, you see what I'm getting at?
Mr. Chairman, we did resolve the issue agency-wide for our correctional officers at all of our prisons. One of the distinctions we did make is our two high custody facilities, which is WSP and the Wyoming Women's Center in Lusk. They are paid at a higher rate now than the other three prisons, the Medium Correctional Facility in Torrington, the Honor Farm in Riverton, and the Conservation Camp in Newcastle. So there's a distinction between our high custody facilities. They are getting $1 an hour more than the other facilities. Our high custody facilities are facing the biggest challenge with recruiting and retention, but the problem of salaries, we do still experience it in the medium correctional facility as well as the other two minimum security facilities. So, I mean, the recruitment issue is a problem throughout the system, but we tried to address both the recruitment system by adjusting salaries up for correctional officers, but also giving that distinction for those high custody facilities, which have a tougher job, if you will, and that they are also our more difficult areas to recruit for and retain staff.
Questions?
Mr. Chairman?
Yes.
Are the correctional officers in their own classification under the Hayes study? Any idea where that they fit in?
They're in the general pay table, all classified as a COPR 5. I don't know specifically the actual grade, but I think their pay grade changed.
Okay, so when a salary survey is done, are we assessing correctional officers in the survey sample as well? Okay. Thank you.
Questions, comments? I think it's quite a decision you're going to have, quite a conversation, Patricia, you're going to have.
What we'll do we'll treat this just like an employee comment, and then we'll get a packet together for you to show what has been done and where they fall in the market analysis and address the issues that come up. I think I was just trying to remember where Rollins sat on the housing allowance in Carbon County, and last year it was 4th, it looks like.
No, it's alphabetical.
Oh, it's alphabetical, sorry.
Just,
Where's Teton?
so they're just less than $100 off.
So they're only $100 off from getting the allowance. So, and that's on our website. Anybody can go and look at that too. So we'll get all that information for you so that you have a better understanding exactly the problem.
Very curious about that nearness to that compensation level.
Mm-hmm. Yeah. That could change, coming into this April, but it looks like it seems to be right there.
Mr. Chairman, is there a way that we can specifically isolate out Rollins and have a different pay schedule for them? Or, I mean, it just seems...
Pay schedule for the correctional officers?
Yeah. In other words, I'm convinced that the problem is in Rollins. You know that it isn't so much the duty that they have to do is common to another prison facility. It's the situation of Rollins and the inability for them to recruit and retain at that institution. And I like to see these kind of things get solved, and I don't know, you guys are the experts on it. And
well, I think one way we could look at it is see how close they are with the housing allowance, because if I'm not mistaken, that's a big issue, and one of the bigger issues in Rollins. If they had an additional $1,200 in their paycheck every month for housing, it would help. So if they're that close to the housing allowance, I mean, that's something I would need to talk with economic analysis and who looks at that to see how close and if we can adjust any of those numbers. Or we get a situation where we single out a community. And that's something that is somewhat difficult to do. And then every county wants to be singled out for one reason or another. So we want to make sure that we are consistent across the board on that.
It's actually $300.
In agreement with what Representative Madden said, I serve on a jobs and workforce policy team, a sub-cabinet group with Director Lampert, and a frequent topic of his input into that group are the difficulties with recruiting and retaining correctional officers. I'll admit that this is my first exposure to what their hourly rate of pay is. Frankly, I'm amazed, and I'm not surprised that the turnover is as great as it is, that it exceeds their ability to recruit and retain. That's why, in the general sense, I headed toward that question of the Hay methodology. But I do think that the locale in the state, just small population, which makes recruitment very difficult, and the pay rate, the housing allowance, those are all moving parts that tell me that it's probably sort of an emerging unique situation here. If not unique to the Department of Corrections in Rollins, I'd be curious to see what the turnover rate is of other state agencies' employees that are in Rollins. For instance, we've got an office there. But everything that I've heard over the last couple of years indicates to me that these jobs are tough ones. They're dangerous jobs. They're not without real risk. And I don't know what the latitude of the commission is, but I think a holistic analysis of what a menu of options might look like might be a good idea. I realize that budget's a whole separate issue, and that has come in front of the legislature and go through the governor's office as well, but I'd like to know more.
And Brenda can correct me if I'm wrong. The budget is the biggest piece, because they have the ability to hire and move people within that range. They just don't have the funds for it. So I think that's probably the biggest piece.
Yeah, Mr. Chairman and Commission, one of the philosophies for state government is when you hire people in, you don't create pay inequities. And so that's one of the issues that we've had is with the compression and stuff. As we hire new people in, our range to be able to bring them in at a competitive salary is very little, because we've been hiring in. And if we hired someone in at a higher rate than what longer-term employees are getting paid, that would be unfair, and it would create those inequities. So we are a little bit limited in what we can offer at the time of hire, because we don't want to, create those pay inequities with our longer-term staff.
And I just want to correct, I was in error. It's about a $340 difference. I did a quick look and calculated my math wrong. So they're about $300 off of which is still not a lot, off of the housing allowance
Rather thorough analysis of this situation, and it appears to be if I can say, just a regional, county-wide situation. I'd like to see a pretty in-depth report back to us to see what our options may possibly be.
And we can do that.
Thank
A
you.
lot of that has actually already been done between the Department of Corrections and ANI HRD for the studies, so I think that's definitely doable.
Mr. Chairman, maybe they're asked, there's a justification for hazardous duty because of the building falling down or something too. Maybe, I don't know. That'd be something I'd think about if I was going to apply for one of your jobs.
Thank you so much.
Thank you.
Any other public comment? Public comment. Public comment. Public comment is closed. Anything left for us for the good of the order?
That's all we have right now. The only other item is to set the next compensation meeting, which we usually carry by phone because it generally is just the housing allowance. We have had discussion about whether we move, and it has to do with if you guys have a recommendation, for example, the pay tables. Is it better to have this discussion in April so that there is time for monies to be asked for in the budget, maybe an interim topic, something like that. So I wanted to open that up to you. If you think it's a good idea to switch it to the April being the big meeting. There's a problem with that too. I think this is always a problem because the market analysis is not done until the end of October, which is a scramble for us to get all those numbers together for this meeting. But if we did it in April, you would have, the information would be about 6 months old, but we would also have the housing allowance at the same time. So there's pros and cons.
Well, at any rate, Mr. Chairman, we should have it on the agenda in April.
Okay.
Because we need to, we don't want to get in a situation like we are this year and saying, well, it's only 2 weeks until the budget comes out for the governor's office. We want to get prepared for this in April. So what if we have old data? We already know what the data looks like.
Correct.
And it's not going to get any better.
So we could plan on a full meeting similar to what we're having right now instead of a telephone meeting to go over it again for the pay tables if that's what if you would like to do, beyond the fact that you've already have a motion and that'll already be with the Management Council and the Governor's Office.
Rate situation concerns me enough that I figured I'd like to meet again in more appropriate timing with, because we spring a request like this on the governor. That's kind of a nasty surprise that I know he does not favor at all. And I'm reluctant to do the springing on him, I think maybe an interim topic study relating to this. I'd like to have a little more in-depth discussion because of retention, training. What is it costing us by keeping these rates low? So I'd like to go into a little bit more in-depth discussion in the interim so we've got more information instead of just going in and saying, hey, and springing something on the governor, which I don't want to do.
And I think we can get that together for those points that you just listed for the April meeting as well and talk about it further. Because there will only be probably 3 topics on the April meeting, which would be the housing allowance, the 2017 market analysis, and anything on the employee requests. So we could have an in-depth discussion on the pay tables at that time too.
This discussion should also be directed toward Management Council. I don't like catching them unaware of either.
I'm sorry, I didn't hear that.
Management Council, this discussion of pay and communications back and forth, see that they are copied, please.
Yes, statutorily, they have to be copied. So we'll get all of that on the motion. We'll get that copied to the Governor's Office and the Management Council.
Mr. Chairman?
Yes.
My question is for you guys. Do you feel like you can get this on the agenda for the Management Council interim study? You have a reasonable chance of doing that? Because that's, you got a short session coming up. And, I would applaud the idea of it being in an interim study. I'm not sure where it would go. Probably appropriations, I suppose.
I would imagine it would go to appropriations. And the reason I want all this communications is I don't want anybody to be caught up short. I want them to know that what we're thinking, why we're thinking it, because sometimes a little bit of preparation in the mind might make us do better with appropriations.
And hopefully, the motion that we passed earlier to endorse will facilitate this and not spring any surprises, because it does ask for consideration in future budgets. So the timing probably would come together fairly well if in the February budget session you all could get enough momentum behind the idea of an interim study on.
I think we can get that. I think we can get the momentum for the interim study. Bringing it to this short session where something needs 2/3 to even talk about it. This is a non-starter right now.
Yeah, and my comment was specific to the interim.
Right.
The interim idea.
Right. Okay.
Mr. Chairman, as you all figure out a date in April, I just wanted you to know that I'll be gone the week of the 16th out of state. I realize the commission doesn't rotate around me at all, but I do want to be at that meeting if I can. I'll get on the phone if I have to.
Next meeting in April. Would you kind of...
Just don't have it on the 15th when I'm doing my taxes.
That's on a Sunday.
Well, that gives us all an attitude, I'll tell you that.
Stacey, do you have a date in mind? I know that the housing allowance is usually the second week in April, so.
This year it was on the 16th, so do you want to do the 23rd?
Later the better, I think, for economic analysis. So
I think that's true. Let's
26th?
shoot for that. Let's try to shoot for it. If something drastic comes up, we'll know that we erred, but let's 26 now. Okay?
Chairman, one other question.
Representative Matt, yeah.
What kind of time would you need to do a turnover study, a retaining study? And I'm not just talking about, retaining or turnover in, the prison system, but what tenure do they have? The turnovers are coming from. Is there enough of a sample there that we could say that this compression is causing turnover among the more experienced employees? And then I guess maybe another thing we would find useful would be what the turnover is by department or by job or something that we're going to have as much ammunition as we can for this.
Absolutely, and we do have that, the majority of what you had just discussed, we have that information. Now, when it comes to management over classified staff, I'm not sure, but I think Stacey could probably discuss that. We do have turnover.
You had tables you passed out, so maybe it was back when you were.
Well, we have what we call a workforce report. And the workforce report, we are trying to get it onto a biennial basis now, because it's not a lot of help when you're doing that on a yearly basis and it comes out in January when we actually need it in July. So this next workforce report will come out.
It'll be fiscal year, so it'll go July 1st of 2017 through 6/30 of 2018, and then we'll have that available August, September timeframe. But in the interim, we can run some numbers for correctional officers or what departments, classifications, whatever you need.
And we can do it by agency. And we have the information, it's just not in a pretty package on our website.
Yes. Yeah, I know what your work schedule is.
I know this is not just Department of Corrections. I want to see the succession planning, because that enters into the same thing too.
Absolutely.
It isn't just an engineer at YDOT or a corrections officer or a whoever. We've got a lot
Right.
on our plate here, folks.
We
And
will
no
do
money
that
to
across,
put
we will
on the
get
plate.
prepared for that across the board for April and well before. We could probably get you some preliminary numbers fairly quick.
Okay. Anything else to go to the order? We are adjourned.